The first important thing I hope I wanted to say at least, it was that in Palo-Alto's DNA, we have already the research genes. Because already in our school prehistory, there was already Bateson's research, which had a very extremely modern design, because it was a research that was concerning transversal subjects, and so that was how Palo-Alto was born. Next. Then it happened that the MRI continues with an impressive research program. You can see that one of the first projects was the normal family research, in which they were trying to find normal families. That means families that didn't have any problem. Then was Vastavic's research on communication and diagnosis in families that he was doing with Don Jackson. Then came obviously the Brief Therapy Center itself with the research on, and the research itself, and then the research on families of Marines people. They were trying to see how a family reconstitutes itself when somebody lives for a long time, like 6 or 8 months. There was a research on alcoholism and family dynamics, and there was Asperia, that was a continuation of Betson's research with psychotic patients. And there was also even research concerning the double-bind symptoms and LSD intake. So this gets us to see how it has always been an important part of the brief therapy genes. There was also some statistical research, particularly at the Brief Therapy Center. They roughly said that they had 75% results with patients, and they were based in a 10-session frame, and the mean number of sessions was 7. They also discovered at the time that they had much better results when they saw several people in the same family or couple instead of just working with one client. We don't know yet if this is because people were more clients and they would come more to sessions or not, but that's something they studied. Then the IGB, it had done some light statistical research, but we had obtained quite a bit of information concerning the relationship between therapists and clients, and there was some nice ideas concerning the perception of our clients on the model, on the brief therapy model. At CIRCÉ, our research has mainly been conceptual, with the models of Pearl, Pasto, Texo, and most of these are ways of instructing new therapists, coaches, parents, managers to apply the basic model of stopping attempted solutions and acting at different levels. Then, obviously, where Gianluca works, in the CTS d'Arezzo, the Centro di Terapia Strategica, it's one of the most structured and powerful research programs that comes from Giorgio Nardone's team. So you, Gianluca, can talk much better about this than I can, of course. But these have permitted you to develop powerful protocols for working with psychopathology mainly. Then, Palo-Alto and Le Futur. We have been divided for different reasons these last years. And Big Fish would have said logical that we've been separated because as therapists we're all divas, and so we want to be so special, each one of us. But I think that today really our time has come. Complexity is the most challenged characteristic of our world. Economy, business, families, couples, environment, all around there's a need of expertise with systems and with efficacy and efficiency. So what can we say more about Palo-Alto and the future? So everybody has heard about Palo-Alto, more or less, coaches, psychotherapists, but I don't think the main ideas have been really understood. Many people have heard the name, and they think we are history because they began hearing our name a long, long time ago. But I maintain that our ideas have never been so needed and alive. Sometimes I hear that neurosciences will take the lead, but I had a chance of treating one of the most advanced neuroscientist researcher in France, and she rejoiced decoding the brief therapy with neuroscience. So people don't really know what we do and what we're capable of doing, and this is important today, to be able to communicate. My hope, a real hope, is that we get back to building together, learn from one another. I think we're capable of displaying an incredible emergent qualities as a system, and we need to be better known, and we're worth it. And also, I think that Palo Alto values are really important, because one of Palo Alto's values, Baton's too, was the idea of their diversity. And we are living in a world where there's interaction, and there's a lot of diversity. And to interrelate different people with this diversity is one of the biggest stages we have to live in a world with peace and abundance. We need to be a working system and use everybody's skill to go past all these multiple crises we live today. And I think that this value is going to be very important. Then, the program in itself. So this program will help us communicate about who has benefited from our services, what type of problems we can treat, how do we answer to each of these publics and these situations, and what is our efficacy measure and scope. It is important to see that we can work briefly and systematically to help people in business, in school, families, people suffering from mental health, and also we can replace all these institutions and make also the institutions work better. Today, the motto is doing more with less. And I think that we are definitely capable of delivering more with less than most of the other schools. If this research has helped us to arrange the relationship between us, the Palo Alto people, it can also enrich us through coming together with the different sensibilities, coming from different points of view from each school. But we have to remember that we have the same family. We're Bateson, Jackson, and Satir's children. Then there was John and Paul and Dick and Moni and Jean-Jacques and Giorgio, Irene, Wendell, and even me, Teresa, the old lady, and all the others, for those of you that are younger. I heard once Jim Cohen talk, why did brief therapy never conquered the world? And what he said is that there was a minimalistic stance, minimalism in the way we acted. Our position was minimalistic, our way of working was minimalistic. But that put us in a too much one-down position. That put us in a position in where we were refusing to sell, which wasn't that much one-down position, it was a little bit one-up. People had to understand us, we didn't go and sell and explain. The type of therapy we modeled, in which we were telling people that we could change very quickly what they were struggling with in very long time. We were very, very outside the model at the time, I would even say at our time today. And there were some mistakes, some real mistakes we made. What he says about the mistakes is that we refused to talk the language of the other professionals. We were against medicalization in a very stubborn way. We rejected research, especially clinical tests. We resisted to adapt to change of context, not especially with women, because there were very, very few women at the basics of in the first group, and it was real rupture with the next generation. There was what he did propose, Jim Cohen? He said to adapt ourselves while keeping our integrity, to relate with all educational institutions, certainly universities, to encourage and help the new generation. That's why I'm here mainly today, to bring in a big diversity of people, maximum diversity and not close, to collaborate with researchers, which I really hope we're all going to do, and to translate and establish relationships with other diagnostic categories. And this has been a long, long discussion we've been having, and I hope we'll continue it with Gianluca, about how we relate and establish relationships with other diagnostic categories.